you've already heard me speak, so I'm just going to introduce these two. I am going to introduce it with this idea that cancer is also a metabolic disease. And Catherine Crofts, are you still here, Catherine? Yeah, so I've always wanted to ask you this question: why is it gingerbread man?
Because I am a lousy artist. It was my original scribble was supposed to have been a person. It might have been Karen who looked at it and said, "Why have you drawn?" Well, was Karen or somebody else? Karen put together the slide with the original gingerbread man in it because somebody looked at me and said, "Why have you drawn a gingerbread man?" That's Jason. Because I'm a lousy artist. Okay, because everybody misses the point because they spend the whole time trying to figure out why it's a gingerbread man. So ignore the fact it's a gingerbread man. This is the result of too much insulin, and it's neuropsychiatric conditions, including Alzheimer's disease and Parkinson's disease. Matt has done first in the world studies on ketogenic diet in both of those conditions. It's type 2 diabetes, as we know. Whoa, did I do that? No. It's endocrine condition, but importantly, it's all of those cancers are also metabolic conditions. And notice that all the big six are on there. But there's some things in there that I found really interesting when I saw tinnitus, vertigo, Meniere's disease, periodontal disease, and then circulatory conditions. You know, all the heart disease is in there: osteoporosis, osteoarthritis, rheumatoid arthritis, neuropathy, and erectile dysfunction. Now, isn't that most of the conditions that we deal with in general practice? You know, so insulin resistance, metabolic syndrome, it's all the same condition, and cancer is also a metabolic condition. So I'm going to shut up now because you've heard way too much from me, and I'm going to hand over to Sirona. I think Sirona is actually an angel. When you look out into a medical audience, it's very, very unusual to see people crying, but I warn you, you're probably quite likely to. I've only ever seen doctors crying from boredom in a lecture. Sarona Rameka.
Thank you. Talofa, kia ora everyone. I'm Sarona Rameka. I'm very grateful to be here, so thank you for the invite. I was born and raised in Christchurch. I live in Taupo with my husband Vernon and our daughter Pepe Lilio. I'm 42 years old and I'm a recovering sugar addict. This afternoon, this is just going to be a very brief insight into quite an incredible journey. And as I've already been introduced, it's a journey in cancer, solely managed with a ketogenic diet and regular 7-day water fasting. So I'll start at the beginning. When I was 26 years old, I was diagnosed with myasthenia gravis, which is an autoimmune condition. And how that presented itself is my body just started to shut down. My muscles stopped working, my limbs, everything became heavy, and it started to affect my breathing. And they found a small tumour in my chest, which was benign, and that was taken out with keyhole surgery. And then the 11 years after that, it was just managed with azathioprine, which was just a drug to suppress the immune system. And then you never would have known that there was anything wrong with me. I tried to come off the drugs twice, and twice I relapsed. So I just thought that I was going to be on it for the rest of my life. And that was okay because I was fine. So at 37, life was great. I'm married and I'm pregnant with our first baby. I did have a really difficult third trimester, so I was having a lot of breathing issues, and I kind of thought maybe it was the myasthenia. I went into A&E twice, and twice the doctors sent me home, and they said that it was just baby pressing on my diaphragm. So as it was my first birth baby, I thought I was just being a wee bit dramatic. But 1 week out from a planned inducement, the stabbing pain in my chest it was just unbearable. And I went into A&E again, and this time my midwife would not let them send me home. And that's when an X-ray revealed that there were tumours on the left-hand side of my chest. Covered my heart, my lung, and it was just the most scariest time for us because we had just, been looking forward to the birth of our first child, and then we had to deal with this. 3 doctors in white coats came in and gave us the news that it was cancer, and I still had to give birth to our baby. And there she is, Baby Liliu. I just think she was a miracle, how she grew through what she did. She was fighting for room in there. And she was a healthy baby as well. The news was bad. It was incurable. It was too large to operate. And I was offered palliative chemotherapy, which everyone here would know there is no cure for that. I did ask the oncologist once what the chances were of surviving, and he said, none. And, in hindsight, I'm really glad that he was that brutally honest, because if he had given me just a glimmer of hope, I think my husband and I would have chosen a very different path. So Vern and my husband Vern, we started looking for alternative therapies. We hadn't ruled out chemo. It's kind of what you do or what you know when you're diagnosed with cancer. You have chemo and, that's it. There were no other options. But we were just thinking, what could we do while we waited for the chemotherapy to happen? And so we were just looking at different foods. We were looking at the alkaline diet. And I went home and I prayed a lot. I believe in God. And God gave me this scripture 5 different times through different people. And it was Jeremiah 29:11. For I know the plans I have for you, plans to prosper you and not to harm you, plans to give you hope in the future. So I knew in my heart that healing was mine, but I just needed a medical strategy. Now, during the pregnancy, we had made a routine appointment with Matt, and it just so happened to hit a few days after our first oncologist appointment. And I almost cancelled it because I thought, what's the point in dealing with the myasthenia? Because Matt was my neurologist, for that an initial disease that I told you about. But my husband made me keep it, and it was just meant to be, because Matt had been doing a trial for Alzheimer's and the ketogenic diet. Or was it Parkinson's? Parkinson's, sorry. And he had also been doing fasting on himself. Of course, he couldn't find any patients to do fasting, but he was, he had been doing fasting. So he gave us that bit of paper around the middle, and he just wrote down all of these things that we should go home and research. He said he had a colleague, Deborah Murto, and if we wanted, she wasn't taking any new clients or private clients, but he would give her a call and it was just amazing. It was answered prayer, and I started keto straight away. I just knew that this was the path for us, and Matt was just such a blessing with just his generosity of time and knowledge. So started keto straight away. I went home to my parents. I said, I'm not going to do chemo. For me, there was just no point. If it wasn't going to work, what kind of quality of life, would that give me? What were our children going to see for no cure? So I'm not going to do chemo, but I'm going to not eat I'm going to fast. So that was a weird thing for them to hear. But they were super supportive. And we met with Deborah Murto, and I began a 10-day water fast. That was really, really difficult because the myasthenia, I'd been on a drug suppressant for so many years, and then fasting boosts your immune system. And so I was on a catch-22, too far left, this would kill me, too far right, the cancer would. And so the first fast made me relapse in the myasthenia so much that I ended up in hospital. And I had to have a IVIG, which was a white cell transfusion. And because Matt was unsure of what that would do to my glucose, the first fast ended up being a 12-day fast. And that became, my life for the next 6 months. Every time I would fast, this is kind of the results of the myasthenia gravis. So just things would get puffy and droopy. I couldn't look after Pep very well, so my parents were coming up from Christchurch and they were looking after her so that Vern could look after me. And we just kind of adapted. Like, I didn't have any other choice. That was it. Now, the first year, I completed 7-day water fasts every 2 months with a strict keto diet in between. We were always expectant that it would work and that I would be healed. So I kept glucose and ketone readings 3 to 4 times a week, just for Matt to, put on his studies. During the first year, I had shrinkage and I had growth. And this was about us balancing the IVIG for the myasthenia versus what we were doing for the cancer. So it was a bit difficult for us to navigate through. And there were a few times that Vin and I thought, are we doing the right thing? You know, have we chosen something that's like way out the gate? We come up to a lot of resistance. Every time I'd end up in hospital because of the myasthenia, the doctors would see that I was not eating the hospital food, and then they would stop treating me for the myasthenia and then send in the dietitians to talk to me thinking that I had an eating disorder. And that was really hard for us because we had, 20 different people telling us that we were crazy and I was not choosing the best decisions, for my family. And then we had Matt just by himself saying, I know this is right, you can do this. And we just put a lot of trust in our faith and a lot of trust in Matt during that time. During the second year, because of the growth and because we were still trying to manage the myasthenia, then we increased the fasts to 7-day water fasts every month. And then the 3 weeks in between, still on a strict keto diet, I would be on weight gain. So I'd just be eating as much as I could, keeping my ketones high to put on the 4 to 5 kgs that I was going to lose during the next 7-day fast. But during that second year, my body, it just made an amazing recovery. So I was having no symptoms of the myasthenia every time I would fast. I was living a full life. I was working again. I was with my daughter. The fasting side effects, they just included like fatigue, shivers, sore muscles, sometimes nausea. But you compare it to the side effects of chemotherapy and it's nothing. And every time that I would fast, the side effects would become less and less. In fact, most of the time, even now, I still play on the side effects so that I get, Vern to look after Pep, or I get massages, or, I go to hot pools. I'm only saying that because he's not here. Right, so after the second year, we were winning. The tumours had not grown and I was still alive. In June 2019, I had a huge myasthenia relapse though. And I hit rock bottom and it came in the form of colitis, just the body really started to shut down, and I spent 3 weeks in ICU. So I couldn't breathe. I couldn't breathe by myself. We had a DNR, do not resuscitate, put on me, and 2 failed excubation attempts. And so it was the scariest and worst moment of my life. But Matt and Vern, they went in and argued to the ICU doctors, and I had God's word. I had his promise. So I knew I wasn't going to die. I just didn't know how long I was going to stay like that for. So 3 months I spent in hospital, and I did get better, and it was a warm winter in Waikato, and we were just grateful that I was out. After a month, I was having a rattle in my chest, and I thought that it may have been pneumonia happening again, because I did have pneumonia in hospital. So I went to the doctors to have a chest X-ray, and then that happened. So when I was in hospital, when I was in ICU, the medication that they put me on to sort of get me up again, it was prednisone or triotrib. Like, it wasn't anything for significant cancer shrinkage. It was for the myasthenia. So, there's a lot of speculation about that, how that could have happened. It could have been extreme fasting, because I lost 15 kgs, by the time I went in there. It could have been the high dose of prednisone to get me up. But, there isn't really much more to it. I always say that God's hand was in that. So it shrunk by, I think they say, about 96%. Now, after that, I focused on recovering and putting back on weight, because I think I left hospital at around 38 kgs. I was still on keto, but I cut down on my fasting, maybe 4 to 5 days every 2 months. And then after a year, we found that the tumour had grown again to about 20% of its original size. So again, we sought direction from God. We talked to Matt, and then up to my fasting again to 7-day water fasting every month. And it's still a balancing act for me. Like, my immune system still does crazy things. The fasting will boost the immune system, and it kind of like attacks tumour, and then there's collateral damage. It might do something to my liver, or I've had rippling muscle disease. I've had a lot, actually. But at the end of the day, I still live an amazing life, and I'm still here. So this is my life. That is my 5-year-old. These are my amazing doctors who, I have the dream team. And I'm always in ketosis. I'm still doing 7-day water fasts unless something is happening with, the liver or with something else. But at that time, we know that the immune system is like hyperactive. And I'm a real advocate for fasting. Like, when I had COVID, I fasted and it went. And it's not that I don't enjoy eating food. I love food. Food is also social, and it's emotional, and it's habitual. And that was always the hardest part. It was always the mental battle. It wasn't so much the physical, or it was at the start, but that was myasthenia. Anyone who didn't have myasthenia, what is fasting? It's a bad hangover for 7 days. But, I'm a real advocate for it. My family fast, not all the time with me, and not for the full 7. My husband does 3 every time I fast, and if he gets too grumpy, I just, can you just wait until after? You're not helping, even though he's trying to do it for moral support. But it's amazing what it does for the body, and I've done nothing else but fasting and keto. So it's very empowering to also have some control over my own healing. So I praise God every day for answered prayer. He's brought about my healing through therapies, people, events, and even his own direct hand. And I honour people like Dr. Matthew Phillips and Dr. Glen Davies, who strive to do more and to think outside the box. So the future of medicine, I like to think that, in a way, I am. What has happened to me is a great example of where the future of medicine should be heading. And, that's about hope and a plan and a future. Thank you.
You've heard Sirona's story. And seeing as this is the last talk, I'd like to once again thank Grant and Louise Schofield and the PREKURE team for arranging this conference, which has been equally amazing today. So this is about metabolic therapies in cancer, and I think Sirona's talk is going to be tough to beat. Let's look at what cancer is. Cancer is a disorder, and it's associated with a progression of hallmark changes in cells, followed by abnormal cell growth and spread. These cells become a little too wild and rambunctious. We've had over a century, actually, with the same theory for cancer, and that is the somatic mutation theory, which regards it as essentially a genetic disease. There's mutations that occur in the genetic code. If you remember my talk from yesterday, the seeds of the garden. There's a mutation in the genetic code, and that somehow causes these problems. So let's look at that in more detail. You have a quiescent cell. This is the somatic mutation theory. You get mutations that begin to occur in the nucleus of the cell, which is the center of the genetic code inside the cell. These mutations accrue over years, and some of these are called activated oncogenes, which promote cell growth, and some are inactivated tumor suppressor genes, which are supposed to stop cell growth, and they get inactivated. And then you get unbridled growth and proliferation. That's essentially what the theory is saying. And there are some inconsistencies with that. So just as I did with Alzheimer's yesterday, I'm going to show some inconsistencies with this cancer theory. The first is, of course, that there is a lot of mitochondria damage. So as Glen just spoke about, I see mitochondria as the ultimate arbiters of the terrain theory. If you're healthy, you have healthy mitochondria, you really should have high resistance to all these lifestyle disorders, of which cancer is one. The somatic mutation theory does not explain the evidence that there's striking mitochondrial damage in all types of human tumors. So you get reduced numbers of these. There should be a few hundred in each cell running around the nucleus, like outside of it. They're reduced in numbers. They don't look right. So the folds inside them, where the energy is produced, is all abnormal. And they normally come together and divide. They're populations. They're actually a community. And they don't do that properly either. So again, normal mitochondria on the left, in the red circle, you can see the nice folds. Those are the cristae, that's where the energy is made. And this is one on the right from a cancer cell. And in this particular cancer is called GBM, or glioblastoma multiforme, which is a very terrible brain cancer. Different from Sirona's metastatic thymoma, but both very bad. The second inconsistency with the current cancer theory is that many things can cause cancer, just like many things can cause Alzheimer's. So how can cancer, which is a very stepwise, specific and defined process, be caused by so many different things? All these things. Metabolic syndrome has been implicated, carcinogens, radiation, hypoxia, viruses, inflammation. There's more. So how can all these very different, seemingly different things turn this normal cell into this cancer cell? Again, hint, all these things damage mitochondria. The third inconsistency, this is powerful, this one, is the hybrid experiments. The somatic mutation theory simply can't explain the results of these experiments, which have been performed by multiple labs around the world. You can take the mitochondria and cytoplasm from one cell and the nucleus from another cell and put them together to create a hybrid. That's a cell that has features of two different cells. Now, red is cancerous, green is normal. If you take the normal cytoplasm and mitochondria from a normal cell and you combine it with a cancer cell's nucleus, the somatic mutation theory says because that nucleus has all the genetic mutations, the cell should become cancerous. But virtually 100% of the time, it stays normal. Conversely, if you take cancerous cytoplasm and cancerous mitochondria and you slap a normal cell nucleus in there with no mutations, it stays cancerous virtually 100% of the time. This has been repeated by multiple labs who are actually, some of whom were trying to prove the opposite thing. And this has been interestingly ignored for decades. This says that the determinant of cancer is in the cytoplasm, and namely the mitochondria. Fourth inconsistency, fourth final one I'll go over, although there's more, is this thing called the Warburg effect, which some of you I'm sure have heard of. Cancer cells show this thing called the Warburg effect, and normal cells don't. And the somatic mutation theory doesn't really give much credence to this at all. So normal cell on the left, cancer cell on the right. Basically, the normal cell can use glucose from carbohydrate, or it can use fatty acids and ketones as an energy source. So it runs as a hybrid engine, and it can swap between fuel sources. The cancer cell is different. It upregulates its glucose intake tremendously, and by that I mean 10 to 100 times. It's really huge, and it's a glucose hog, and it's not well able, if at all, to utilize the fatty acids and ketones. So, you know, obviously they love sugar. So let's look at a different theory of cancer, a mitochondrial theory of cancer. This theory of cancer is very similar to the mitochondrial theory of Alzheimer's. It's just that this theory does not affect this happens not in neurons, but in many other types of cells. So you get a normal mitochondria that's exposed over life to all those various insults I mentioned, and you get collections of them that ultimately damage the mitochondria. The mitochondria are damaged in the cells, so it's not producing energy well, and it uses the Warburg effect, up-regulating its glucose intake so that it can make energy with a plan B method of production outside the mitochondria that helps it survive. Not all the mitochondria cells do this. Most of them die. They can't do the Warburg effect, but some can. And because these cells are routinely repairing their genetic code, the cells doing the Warburg effect, although they're surviving, you need optimized energy metabolism, healthy mitochondria, to keep this genetic code fully repaired. So then you get these mutations seemingly appearing at random, and this explains why there's so many and different mutations in these cancer cells. And that is how you get cancer. This theory makes more sense to me, and if this theory is right, then we have to go to the far left picture and restore those mitochondria, prevent them from getting injured and causing cancer. The genes there on the fourth box to the right are a side effect. They're a downstream effect. They're a response to the cancer process. So trying to fix those genetic alterations won't work, and it hasn't worked. So this introduces the concept again of fasting and ketogenic diets, which is what Sirona used. So fasting is again a voluntary abstinence from food and drink for at least 12 hours. It's not involuntary. Okay? It's not starvation. That is starvation. It's controlled. It's not uncontrolled. Fasting generates ketones from body fat. Ketones are a superior fuel for the brain and for muscles and for almost any other cell in the body. There are many ways to do it. So again, time-restricted feeding is a good one. 16 hours of fasting a day, 8 hours of eating. You can go 18 and 6. You can go 23 and 1, or 1 meal a day. You can do 5 and 2 fasting. So Dr. Mosley's fast 2 days a week, eat 5 days a week. And then you can do the longer ones that Sirona's used, and they are the tip of the pyramid that Glen showed. So you can do anything longer than 2 days is considered a prolonged fast, so 4 day, 5 day, 6 day, 7 day. Ketogenic diet is very similar to fasting: high fat, adequate protein, low carb. And it produces ketones too, but they come from dietary fat. So again, fasting and keto are very similar. They both produce ketones, it's just they're coming from different sources. And again, it's mainly a diet of elimination, which we heard about earlier today. So it's removing 3 things: sugars, grains, and fruits. And it's adding 1 thing: natural fats. Now, why remove those 3 things anyways? Well, if you look at evolution, nobody in the world anywhere evolved with huge amounts of sugar, their ancestors, for 2 to 3 million years. And if you go back past 5 to 10,000 years of human agriculture, which is about 0.5% of all human existence compared to our 2 to 3 million years of hunter-gatherer metabolism, the grains, no communities existed on large amounts of grains or fruits in their current form either. The original fruits were much smaller and more wild and had a lot more fiber. If you look at ancient watermelons and peaches and bananas and so on, very different from what we eat today. So that's why the ketogenic diet actually takes us to our true roots, because you're removing these things that were all created not just by processing, but by human agriculture. I see the keto diet as a method. It's a diet, yes, but it should be seen as a method for getting the body into a certain state. If you see it as a method, then you don't have to argue with people who say carnivore is better than vegetarian and omnivore and whatever, because it doesn't matter how you get into the method. You can do it as a vegetarian or as a carnivore, it's fine. And indeed, I have patients that do both. You can go keto Mediterranean, keto Mexican. I have several Maori couples doing keto Maori diet, very, very amenable to keto. Again, Canada, where I'm from, BC, the indigenous cultures there, their diets, ancient diets, were ketogenic. So those are easy to modify. You can go keto Indian, keto Thai, it doesn't matter. Keto is amenable to any ethnic cuisine. So, in addition to restoring mitochondria, why might this have worked in Sirona? Okay, for cancer, first, fasting and keto elevate ketones. These provide a superior fuel source for normal cells. Compared to glucose, they produce more energy per unit oxygen and fewer free radicals. At the same time, the cancer cells can't really use them to grow. The second thing is they lower the glucose, fasting and keto. Of course, you're restricting glucose intake. This chokes the Warburg effect. It chokes the main fuel for the cancer cells, okay? The third thing is you create this thing called differential stress resistance. Now, often we use chemotherapy. Sirona didn't, but most cancer patients do, and radiotherapy. When you do keto or fasting, it makes the cells go into a stress-resistant mode, and they hunker down and they become more resilient. This is sort of Grant's concept of hormesis. They become more resilient to all stressors, including chemo and radiation. And that's a good thing, because your normal cells stop dividing, they stop growing, they go, okay, time to just survive. And they last through the chemo and radiation better. This has been proven in people. And at the same time, fasting and keto induce differential stress sensitization. They make the cancer cells more amenable, because they can't do the chemo and radiation effects, because they can't stop dividing. They have to keep growing. They are cancer by definition. So there are multiple mechanisms here by which keto and fasting could really do a serious number on cancer. And of course, the fifth one is that by restoring mitochondria, that is the ultimate thing, is to try to prevent, if the mitochondria theory is right, try to prevent cancer from appearing in the form of a recurrence down the line, or trying to prevent the primary tumor from, another part of it expanding that maybe your radiation missed. So there are so many different ways that this metabolic therapy could work. And again, it's about changing the whole orchestra of metabolism in the brain. You're not just targeting a pathway like a medication would, and it's not just focused on destroying things like chemo and radiation are. It's about ultimately restoring and healing. Okay, so this is why I'm really quite excited about these strategies for cancer and other disorders. And the idea is that you make life better for normal cells, you make them stronger over time, and the cancer cells get weaker and they're disadvantaged. And the most aggressive ones would die the quickest because they need the most sugar and they're trying to grow the fastest. So this leads us to Sirona. So this was published, I can't believe it was published 5 years ago now. Sirona was 37 years old at the time. She had myasthenia gravis, which is a bit of a wacky neurological condition that we see not uncommonly as neurologists. And she was diagnosed with a stage 4 metastatic thymoma. Now there's cancer with a small c and there's cancer with a big C, and this is cancer with a huge C, okay? So it was deemed unresectable by surgery. Radiation was not an option. It was just too big, too complicated. And her oncologist offered a year of palliative chemotherapy. So he offered a plan, but he offered no hope. And you need both, don't you? You need hope plus a plan. Hope on its own is no good either, but you need both. So she declined the palliative chemo, as she mentioned, and opted for its combined metabolic strategy. So I really like taking it to the, again, as Grant would say, next level. Rather than just use a keto diet, or just a fasting protocol, or just low carb, or just a high intensity exercise program, put these things together. It's a creation, it's a painting. Make a program that is not only tailored to the patient, but tailored to the condition, work them in together, because I think these metabolic strategies are like Lego. You can build beautiful things and try to do some good. So she did this for 2 years, a 7-day fast every 1 to 2 months. And yes, it's difficult at the start, but after you do a few of them, it's not so hard, as Sirona will attest to. And she can even use it to her own advantage, saying to Vernon that she's got these certain side effects, which is very clever, by the way. I'm going to have to use that one myself in the future. Anyways, this is a CT scan of Sirona's chest. On the left is a coronal section, so imagine you're seeing her face on. And the red, I don't need to put the red there, but there's the tumor. It's the size of a small football. And there's not much room in Sirona's chest, as you would tell. She's not very large. You can't see it, but at the bottom, along the pleura, the bottom of the lung, there's seeding of the tumor there, and it was impinging on the heart. Now, the way this normally would produce death in someone is it would push on the heart and produce a reaction around the heart. And basically, the heart would not be able to pump blood, and the person would die. And the oncologist indeed had written a letter, which I didn't tell her about at the time, saying, I expect Sirona to come into the ED any time now with this complication, in which case she should be treated palliatively. You can see on the axial CT on the right, that's where she's lying flat with her feet coming out towards you. You can see again, it just gives you an idea of the size of this tumor. So this case report was written up there in this journal a few years ago now. So our client stuck with her metabolic strategy for 2 years. And that was her at the first CT scan. Now, this was not an easy road. Sirona is very brave, and her husband is too, I should say. And they stuck with this, even though the outcome was by no means guaranteed. It still isn't. But there were lots of twists and turns, and I certainly learned a lot. The thymoma originally, that second one there, it decreased by 30% after a few months, and we were really happy. And I think Sirona would agree with me, she got a little bit less strict with her metabolic program. And then it grew back almost to its original size in the third one there, which was crushing. So then she got really disciplined again. Now this was interesting. The thymoma actually got bigger over the next year or so. But can you see, if you look carefully at it's changed in its consistency and texture. It's a little less dark, it's patchy. Now this was when she was in ICU. This was right at the worst moment. And yeah, Vernon and her refused to give up. And in retrospect, this was when the tumor, when things were looking at their most dire, this was right before the goodness happened. That big tumor was mostly necrotic and it's swollen, I think. So it looked really bad, but that's actually a sick cancer. And in retrospect, that was the crucial moment, not giving up, right when things were at their worst. She could have given up. And indeed, there was pressure from virtually every source to give up, including within my own department, I'm ashamed to say. So, what happened? There were at least 3 potential mechanisms, may have been more, but I think these 3 were the main game, and I can't figure out, I'm still trying to figure out which of the 3 were the most important. So, of course, she had done a lot of fasting and keto. And then because she was in ICU for 2 to 3 weeks, she lost more weight, so enforced fasting. And all of this would have put incredible metabolic pressure on these cancer cells. So I think that's got to be considered. The second thing is, yes, we know these protocols augment immune system function. The evidence is increasing by that year by year, increasing for that. And it may well be that her immune system kind of switched and was able to actually start damaging the tumor itself. The third thing I'm not so sure about is the steroids we used. This is not a routine treatment for cancer, obviously, but these thymomas often contain a large number of non-cancer cells mixed in with the cancer cells. And the steroids don't do much against the cancer cells. If anything, they might feed them because they elevate your blood glucose. But they can destroy the non-cancerous components of the thymoma and reduce the bulk. So that may have been a part of it. We're testing that theory right now, actually. I won't go into the details of that, but I'll know the answer to that probably in about a month. So Sirona's an outlier, right? An extreme one. And rather than just ignore the outliers, we should study them. What if we could replicate this in more people? So, you know, here we are 6 years down the road, given a year to live, 6 years down the road, she's doing awesome. But we got to keep studying and thinking to see if we can help more people. So remember, this is only an N of one person. But despite the uncertainty, the excellent outcome really does warrant further investigation. I think it's more important to study one Sirona than 100 people that had the usual expected outcome and are no longer with us in terms of what happened. It's really important to try and replicate this for other people. So this has led us to our current trial. We're doing a trial in that initial slide I showed you with the glioblastoma multiforme mitochondria in brain cancer. It's a little more close to home because I'm a neurologist and I don't want to get too far off turf, but this should work for most cancers, these strategies. So GBM is a terrible brain cancer. It's basically the worst, one of the worst cancers you can get, if not the worst. And it affects people in the prime of their life, 40s, 50s, 60s. So again, this is a very strict metabolic therapy program, similar to what Sirona is doing. We're doing 5-day fasts every week, 4 weeks or so, and then a 1 or 2 meal a day keto diet. So think about that. You're taking people who are used to eating 3, 4, 5 meals a day, plus snacks, processed carbohydrates. And I'm telling them, like jumping in a deep pool, okay, now you're gonna do a 5-day fast, you're gonna do keto, and you're gonna do only 1 meal a day, sometimes 2. And guess what? The adherence is amazing because their backs are against the wall and they know that there's, if they don't do something, try something different, the outcome is probably not very good. So adherence is actually extremely high, despite the intensivity of this program. And make no mistake, this is way more intense than any other metabolic attempt at helping people with an advanced cancer ever done. So what we do is these people get 6 weeks of chemoradiation, so chemotherapy plus radiation, almost every day. And then we do 2 5-day fasts, as shown by the arrows. So right at the start, actually before the chemoradiation starts, I get them to do 3 days of fasting. So they're in that state when the chemo and radiation hit. So the cells are differentially stress resistant and the cancer cells may be starting to get a little sensitized. And that's done for 6 weeks. And anytime they're not doing the fast, it's 1 or 2 meal a day keto diet. So you're throwing in intermittent fasting with prolonged fasting. The strength of the protocol essentially relies not on the keto diet, but on the fasting, trying to starve out these cancers. And then you do 6 months of adjuvant chemotherapy with a 5-day fast every time they get their 5 days of chemotherapy, and then a good break in between. And we're looking at the things that matter. Okay, so to the ethics committee, the things that matter with feasibility and safety, granted, you have to do that. But our first patient is actually 2 years in now, and it is feasible and it is safe. We have 9 people doing it now. And efficacy is the one I'm really interested in, and I think the clients are interested in, is do they live longer and what's their quality of life? Really, it comes down to that. So that's what we're looking at. I can't give you data yet, it's too early. I'm not going to speculate and I want to be sure. So I don't want to get people's hopes up unless we are sure. But it's going okay. So, conclusions. The mitochondrial theory of cancer states that mitochondrial dysfunction is the problem. This is the essence of a weak terrain. This is the target Antoine Béchamp needed. Louis Pasteur had targets. He had germs. That's why germ theory won at the time, and it happened to be very effective against the infectious disorders of the day, but now we have lifestyle disorders. We're trying to apply, as Glen said, germ theory to lifestyle disorders. It doesn't work. We need to have a different target. Unfortunately, mitochondria were not around at the time of Béchamp, so he didn't know what to target. He said exercise, he said get sunlight, all these things, but it was vague, so he lost this debate, even though Pasteur secretly looked up to him. And it's said on Pasteur's deathbed, he said, Béchamp was right. It's all about the terrain. I don't know if that's not verified, but apparently Pasteur said that. So I don't know. I don't know. Pasteur was a hero of mine when I was a kid, but now it would have to be Béchamp. So I don't know. They're both heroes. They're both trying to figure out the truth and make the world better, I think. I hope they were. So mitochondrial dysfunction, if that's the main problem, then this mitochondrial theory of cancer, which is essentially a metabolic therapy, because mitochondria are the center of metabolism being all the chemical reactions in your body, then that may be more appropriate. Now, if that's the case, then these metabolic strategies are key, right? They're not just like fluffy lifestyle therapies. This is like the backbone of how we should be treating cancer and the lifestyle disorders. In this particular case, the evidence is right in front of you. Sirona is happy, great quality of life. They tolerate my presence every time I ride down and crash at their place for a night and just hang out and make me nice dinners that are keto. And yeah, no, it's pretty sweet for me. So, like, she defied all conventional expectations, and here she is 6 years later. You know. And remember, it's just one person, and we're not 100% clear of the mechanism. I think, though, we're going to get closer to that within a couple months. I'll know what the steroid effect was, and I can talk to you about that later if you want to know how I will know that. But, you know, I think it was just so fantastic. It warrants further investigation. So that's why we're doing this trial with the glioblastoma guys. And we're going to see if it helps them. And, you know, if it's about a combined thing of, you know, starving out the tumors and restoring mitochondria and enhancing immunity as well, fine. You know, but what matters is that we help these people to live longer and have a better quality of life. And as the theme of this conference is basically, it's about trying to enhance the health of humanity, which will make us wiser people and a wiser planet in general. So thanks.